One, two, three.
I'm Microsoft teaming with Microsoft Teams. I'm learning and dreaming with Microsoft Teams. The hub and the teamwork of Microsoft 365 in these quarantine times. I'm Microsoft teaming with Microsoft Teams. Yeah, with Microsoft Teams.
Hi, everyone. Welcome to Season 5 of Inside Microsoft Teams. I'm your host, Stephen Rosen. Thank you for joining today, and thank you for your continued support of the show. With COVID, we've seen a significant increase of mental health issues. Moderate to severe anxiety is affecting nearly 40% of the adult population. Depression jumped 7% to affect 1 in 3 adults, and 43% have now reported moderate to severe anxiety. One key that's making this problem even more prevalent is income. Households with income less than $25,000 are 20 percentage points higher and likely to report moderate to severe anxiety than a household income that has more money. In short, those who cannot afford to miss a day of work are the ones who need the most help and are the ones who really are looking for solutions and answers. And that's where telemedicine comes in. It's so incredibly important because it allows providers to reach patients and, not just where they are, but when they're needed most. Our guest today is Vituity. It's a 50-year-old physician-owned and led partnership, a leader in acute care innovation that is committed to transforming healthcare for the benefit of all. They work with hospital partners across the country and are looking to redefine healthcare with an emphasis on equality. They support a borderless employee experience across 6,000 physicians and clinicians, which make up another 2,000 people on their staff that supports them. So I'm excited to have several guests with me today to sit down and talk about this, starting with CIO of Vituity, Amit Nair. Hi, Amit. How are you?
Morning, Stephen. Thanks for the invite. Looking forward to the conversation.
Awesome. Take a moment, tell us a little bit about yourself, and then we'll introduce our other guests.
So my name is Amit Nair. I'm the CIO for Vituity. I get the privilege of defining technology strategy for the organization so that we can make and improve patient lives in all the communities that we serve.
Awesome. Also joining us today is Product Manager for Digital Adoption and Enablement, Sarah Chu. Hi, Sarah. How are you?
Great. How are you doing, Stephen?
I'm doing great. Take a moment and explain your role at Vituity.
Yeah, so I'm a product manager for digital adoption and enablement, like you said. And we really take that seriously, the adoption part and the enablement part. So we want to make sure that people know about the tools that we have, that they know how to use them, and that they feel empowered and enabled to make them their own.
And then one of the key partners that has really helped to bring this whole platform to life is Varun Singh, who is the founder and VP of product for Moveworks. Varun, how are you today?
Very well, Stephen. Thank you for having me. And Sarah and Amit, nice to see you here as well.
Awesome. So, Amit, what does Vituity do? Give us kind of the 50,000-foot view of it.
I mean, like you'd already mentioned, we are a physician group. I mean, what I wanted to add, 2 other areas as a differentiator for us as an organization in the market. Our goal is to improve lives, and we take that to heart because we want to push the boundaries of traditional medicine and being innovative and take on new ways to provide patient care wherever they are located. And a couple of things that I wanted to share with you all is, one, we have an entity called Inflect Health. That's one of our organization that basically provides funding to early stage startup healthcare, specific to healthcare. So through that, we are bringing in different innovation. And we just launched our first startup in the last year called Healthful. That's going to help with patient care navigation in the market for a lot of the folks throughout the country. And then we are also a mission-based organization where we believe that we want to heal the most vulnerable, empowering the underrepresented, and ensure a more equitable future for all. Right, and we do that we just launched our Vituity Cares Foundation. That's what they are focused on. We do that by pop-up clinics that we've launched over the last several years in parts of the West Coast, and pretty soon other parts of the country. And some of the other things that we've done, which is pretty new, through RIP, that's another charity, if you may. We have forgiven medical debt close to $25 million. That was in the Pacific Northwest that we've done, and eventually we're going to do that. So we are one of the first physician group that's done it. Very proud to be part of this group.
I know a big part of your goal was to move on focusing in on patients and not the process, and you saw Teams as a key way to do that. Why did you choose Teams as the way to do that? Why did you say this is the platform to enable that goal?
I wish I had more time to talk to you about this, but I mean, in a nutshell, about 5.5 years ago, when I first joined this organization, our goal was to get into a major digital transformation and looking at our back office platforms and processes and stuff, and how do we empower our employees. And again, back to the whole making our lives better. It's not just making our lives, but also our coworkers and the physicians who are actually providing care at the front line. How do we make their lives better? And we listen to them in the sense we wanted to get to the whole borderless employee experience where they can work from anywhere and at any time. And one of our biggest problem was back in the day, we were very tethered to our desk, PCs, laptops, all connected to our back office system through VPN, etc. So one of the things that we wanted to look at is how do we embark into our cloud-based journey, and Microsoft came up to the top, rose to the top for us, and that's how we started. We're looking at Microsoft and all the technologies through Office 365. How can we provide collaboration, real-time collaboration, which we were hearing that was the biggest concern that we didn't have that within our ecosystem. So, Teams provided us a lot of different ways to now, through different modality, connect with each other and help each other out. And that's one of our first journeys, if you may.
Sarah, let me ask you this next question, which is around adoption. How was that initial adoption? I know we had talked about your adoption team and this cool VIT lounge. So take a few minutes and talk about how you created awareness, which helped to drive adoption of the product.
Yeah, so for us, we're our main audience is our clinicians, especially for things like Teams. And knowing that clinicians are very high touch, they really like things to be explained to them, and that everybody has the what's in it for me. They have the things that they're motivated by. And I think our group is really good at kind of tapping into what those things are for each person and each, person type. So we did create this thing called VIT Lounge. It's Vituity IT Lounge, where every Vitin is a VIP. But basically, it's a monthly program where we have subject matter experts come talk about different tools or different use cases for how they're using, not only Teams, but maybe other products like Forms or Power Automate, or even just like quick tips for ways that they've been able to make their work process better and more efficient.
Now, some of these things happened organically. When we were chatting, you were saying that they kind of found Forms and started using it. Talk about that organic growth, because that's, I think, what every company strives for, is that people will dig into some of these features and find something that reduces a process or makes their job easier. So what were a few of those things that folks found that helped to increase that drive?
Yeah, these are some of my favorite stories. Like as an adoption and change geek, hearing about it, in the wild is always really fun. So one example that we heard was we have this role called a practice administrator, and practice administrators, they really do everything at the contract site location. They are our boots on the ground from the office standpoint, but they're there at the oftentimes at the clinical facility, or now, with COVID times, maybe in their home, but they're really the interface between the office and the contract site, the hospital. And so we had somebody, Renee King was her name, as a practice administrator, and she started creating forms, and then she used all of these great little added features, like having a QR code made up for doing our patient experience surveys. So she had like this nice flow where people could pick the provider that they saw, and it would, she even added in some like notifications, like all of these great things that may seem really small, but it made her work life much easier, and it just really made us happy to hear about how she kind of organically found all of these features.
Yeah. And we've talked about that on the show before, that it's about understanding where the pain is, and nobody knows that better than the people who do this job every single day. And if they can find a way to, improve a process and make it work faster, they're going to know that better than anybody else at the company. And they're also going to share that, saying, hey, we're doing this now, this is going to be easier. And that's awesome. And it's great that folks inside found that. Now, Amit, one of the things that I love that you said was your emphasis on the goal of frictionless, just this kind of single word that you want everybody to point to. Now, help us to understand, because post-care is traditionally one of the hardest things to manage, and that's really your bread and butter is around that. So talk about what your vision was and how Teams sort of helped you to fulfill this.
So I got to tell you, it's not even my vision. When we enable these tools to our end users, and you heard a very great story from Sarah, similar to that, we actually have one of our main areas of focus has been mental health and telepsychiatry, through telepsychiatry. And you know what's going on right now in the market. There aren't too many telepsychiatry available or psychiatrists available to manage care. So our telepsychiatry panel today, the way it used to work was, we had a contract at one site when we have a panel of telepsychiatrists, and they would get a call on a day-to-day basis around different patients that are coming to the ER with a specific episode. And now again, can you imagine hospital? I'm at my home managing these care. So there's no way for the navigators to capture the request and then find the physician and get them to provide that care. So they, by themselves, as they started using Teams, as they started seeing SharePoint, the value of SharePoint, they started to put the two and two together and came to IT and said, hey, how can we bring this experience together in one location? So then we said, well, Teams is another way to bring all of these different processes together. For example, SharePoint. You can bring in a SharePoint list. That's where we can start to manage our patient tracker. If we created a patient tracker form for them. And if there is, and I'm sure you'll probably see an example of that later on in the show, Sarah will probably present it. But I mean, they came up with these ideas, and we sat together with them, and we enabled that tool for them. And to now, where they're taking that even further, where they're using that as a way for care navigation as well, where they're capturing all the different information around food banks that are in different parts of the city or the states, the country, within the country. And now sharing that with different navigators, so when the patient leaves the hospital, that we can now follow them and provide a proper care from a standpoint of, should we call in an Uber for them to be, so that they can go back home? Or where is the closest food pantry for them so that they can actually get food delivered to their house, or they can go get that food from there? Or where's the closest CVS or Walgreens so that they can capture their go get their prescription delivered, right? So I mean, all of that was an internal innovation through folks just coming together and asking these questions because they were exposed to using Teams for collaboration. So now we actually have a Teams channel where all of our our telepsychiatry panel sits, and they know exactly which physician is available through the status, and they ping them and let them know there's the next patient available for them to look at. Or if there's an emergency because there's a patient who came in with a very high acute issue through psychiatry, so they get that person up on the list and find the right physician quickly and provide them access to them. So again, the whole frictionless concept is, how can we make technology enable the technology so that they can use it to their own needs, etc. So
let it carry you downstream, not swim upstream and fight it like a salmon.
Absolutely.
No, that makes perfect sense. Varun, I want to chat with you for a moment in Moveworks. First of all, what is Moveworks? And then I want to talk about how you were brought in to solve this problem that Vituity had.
Fantastic. Thank you, Stephen. So Moveworks is a 6-year-old company now. We're about 450 employees here based in Mountain View. And we've built a machine learning platform that can connect employees to the right resources on the back end and provide frictionless service. So our vision is to create a world where workers get instant help at work. They don't have to wait 3 days, 2 days for mundane, regular issues like questions about benefits or resetting their passwords or getting access to applications or troubleshooting things like VPN. And we work right inside Microsoft Teams. In fact, the company would not have existed if this broader revolution of chat platforms becoming the hub of employee collaboration would not have started and really taken hold with Microsoft Teams. So the reason we were brought in, I think Amit and Sarah, what their focus was, how do they create more room for their service teams to actually focus on external customer needs, and also ensure that when a provider needs help internally, they get that right away. It's instant. And that's what Moveworks powered Autobot does for Vituity and their team, which is it delivers instant service for employees for a myriad of employee service issues, from IT to benefits to other areas, all within Microsoft Teams using natural language as the front end.
Thank you, Varun. So let's take a look at the Vituity demo. So Sarah, if you could walk us through, kind of this day in the life.
Sure. So this is an example site that we have. So this does not have PHI in it or anything like that. But this is where all of the care coordination is happening. And as Amit mentioned previously, maybe this would have been done over the phone or via email, but now it's all in one central place within Teams. So you can see here we have a couple of different channels, general channel, our daily consult tracker, whoever's on call. Really, this on-call channel is where most of the action is happening. And then I'll scroll through it here in a second. But the care coordinators will come in here, and then they'll introduce themselves to whoever the provider is on call, and then they'll say you have these consults, and this, if there are any questions or transfers that need to happen, all of that will happen here in this on-call area. And then so here you can see some of the types of communications that go on, but kind of transitioning over into the patient's tracker. Again, this is all dummy data here, but this is where all of the patient information is being input. So the on-call coordinator, they might be getting information from a contract location saying that we need to see these patients at this particular time. And then they enter all of that into the patient tracker. And then they can see their patients, and people get healthcare in a much quicker way. Okay, so we're kind of switching gears here to Auto. So as we mentioned, our providers love a high touch experience. So one example of something that people used to call our service desk and then need a lot of help on was getting email added onto their new phone. Mm-hmm. So instead of starting a ticket or waiting to get a call back or all of that back and forth, now they can just go into Auto and ask Auto how to set up email on my new phone, and they get an instantaneous answer at any time of the day. And then, as you may know, a lot of our clinicians, majority of our clinicians, are working overnight shifts and have 24/7 coverage. So they might be getting off a shift and think like, oh yeah, I should set up email on my new phone, but it's 2 a.m. So they can now do that whenever is convenient to them. And then another example of something where we can really reduce the burden on our service desk is just a simple password reset. And we have many different passwords actually. So they can get connected to any of the different passwords that they may need to reset, or if you've forgotten your password, you'll be walked through account lockout or any of those processes. And then just a kind of a fun example of something that we've been able to bring into Auto, our Auto chatbot, is things like who is Mike's admin? So we have one Mike who would maybe be relevant for this, our CEO, Mike Harrington. And so oftentimes people need to schedule an appointment with someone and they're like, oh yeah, I need to reach out to Mike's admin, but I can't remember who it is, or they know that the person changed recently. So we've been able to bring all of that into our Auto chatbot as well. Yeah, those are just some awesome fun examples, and it's really improved our experience with the providers and also our employees.
This is amazing stuff. This is great to see what you've been able to do. So thank you, Sarah. So we'll be back with Vituity to discuss security and compliance, because I know that's an area that everybody wants to know about. But first, in our last episode last season, we briefly introduced the announcement with Atlassian Jira at Ignite. So today I'm excited to introduce Tiger to show some of the cool new functionality that Jira has integrated deeply into Microsoft Teams. So let's take a look at that. Atlassian's Jira, Confluence, Trello, and Halp integrations for IT pros and developers with Microsoft Teams makes project management and issue tracking not only viewable across common Teams functions like chat and channel tabs and indirectly meetings, but just makes it easier to work. I'm joined by Tiger from Atlassian to walk us through some of these cool new features that we announced at Ignite. Thanks for joining us, Tiger. What is your role at Atlassian?
So I'm Tiger, and I am the product manager for the Microsoft Teams integration with Jira Cloud. For anyone who missed the announcement at Ignite, we spent the last year completely rebuilding the Jira Cloud for Teams app based on feedback that we had heard. So some of the customer pain points we focused on solving with the app were reducing context switching by allowing complete workflows in Teams, bridging the gap between technical and non-technical teams, and then enabling greater agility so teams can kind of pivot easily based on new information.
And what's great is this isn't a plugin. This is integration into the Teams platform, correct?
Absolutely.
All right, let's jump into a demo.
Yeah, I am super excited to show you a quick demo of the highest use features that we have in the app today. So first, this app is completely free for you to add to your Teams instance, and for up to 10 users, you can give it a test drive without any friction. If you're an administrator listening, I would recommend going into your Teams app settings in the Microsoft Admin Center to allow your org access to Jira. Under permission policy, I'm going to click on Global and make sure this is turned on for third-party apps. Excellent. So if your organization also doesn't want to allow all third-party apps, you can then just search for Jira specifically to give it permissions. So I'm going to go ahead and search for that, bring it up. And as you can see, it's toggled to allowed, which is the default setting. So now onto the good stuff. This is my Microsoft Teams instance here. And I'm going to navigate over to the apps menu and find Jira. And as you can see, you're going to have 4 different options for adding this. We recommend starting with adding the app to a team channel, as most of your collaboration happens there. But to access the full library of features, you will need to add the app to your personal bot or group chat or meeting. Now, once you've added the app to your team, you're going to get some really valuable features. So first, I can search and share a Jira issue quickly within a chat in the message extension. So I'm going to find a developer card in here, and I'm going to send that over to my team. And what's great is you get a very rich link preview. You get a lot of context here, and if you need further action, you can click on View Details, and you'll be able to comment or edit the issue or just open the whole thing back into Jira. What customers also and admins also love is that if you have follow-up messages, you can add them as a comment to that same ticket or create a new one as needed. So there's no time wasted copying and pasting, just a couple of clicks and you're set so you can move on to the next thing and get closer to clocking out for the day. At the top of the bar here, you're going to notice a Jira Cloud pinned tab. This is where your team can see a set of issues with a Jira filter. Now, the filter is something that you set up in your Jira projects. A lot of our customers will often use this as a source of truth, so the whole team can visualize the work ahead without having to leave Teams. You can do a lot in here. You can sort through columns. You can search for issues. You can even create new issues from scratch in the top right there. You'll fill out all the fields like normal, depending on your project. And the last part is also you can action issues as needed. So if I want to add an attachment to this issue, I'm definitely going to be able to do that. So now I want to take you over to the personal chat view. Here's where you can sign up for personal notifications. This is really important if you want to get updated in real time on tasks that matter specifically to you without having to change context and check your email. And we actually just iterated on this to give you additional granular control over the notifications, so you can pretty much tweak them to absolute perfection. And I have an example at the bottom for you as well. So here I can see Tony has just finished this task for me. It's marked done, and I can continue working without a side conversation disrupting me. The last feature I want to point out in this personal scope is the issue tab. So here I can see the issues that pertain directly to me, and I can use one of several filters in this view. I'm going to choose issues that are assigned to me. So as you can see, I have a lot of work to do, so I should probably get started. Customers get a ton of value out of this personal issue tab because you're not just using it as a communication tool, it's your browser as well. And you can stay in here, you can save time by not switching context into a browser and coming back into Teams, and you can really stay focused. So that's all I have for today. And I have to say this integration really embodies Atlassian's mission to unleash the potential of every team by streamlining workflows and centralizing information in one place. This is just the start for us, and we're really excited to continue building and releasing new features based on the feedback we get.
That is a lot put into a very, very short period of time, and I have a feeling we're going to get a ton of questions on this. So would you be willing to come back on another show and give us a deep dive of the developer as well as the IT pro features so we can really dig into this? Because I think there's so much there that IT pros are going to get excited about, and I'd love to be able to show them more, especially some of the cool tips and tricks. You up for that?
Absolutely. Would love to. There's a lot more nuance within the app that I would love to share with all of the viewers here today.
Awesome. Well, I love it. And hey, thanks for the cool Dark Side of the Moon-esque shirt. We are all about the rock and roll here on Inside Microsoft.
One of my favorite designs for sure.
Awesome. Thanks, Tiger. I appreciate it. And we will see you on another episode, I promise.
Sounds
all right.
Great. Thank you.
Thank you. Let's get back to our show with Vituity. So, Myth, one of the questions that everybody has is HIPAA and high trust, and how are you doing all this and keeping it all secure? Because that's been the biggest issue for many companies looking to leverage the cloud but make sure that they meet compliance. So, in about 3 or 4 minutes, kind of tell us, how did you achieve those goals and have the level of security that's required for an industry like yours?
So you got to start with the best, a good partner, right? And that's what our biggest focus was. We see about 7 million patients every year. So we have that many. So right now, since the company's been here, we have seen a little over 41 million patients. So we have all of that records in our back office systems, right? So think about how scary it is. That used to keep me up at night, but not anymore, because we started to work with the right partners. You guys spend over $1 billion in security infrastructure. We could never match that. So that's our number one goal: find the right partner. Check, right? So we got Microsoft as our partner. The other good thing was you yourself imposed a lot of policies on us through your Microsoft compliance portal. So we had to quickly get ourselves aligned to those policies. And there's a real-time dashboard, which is amazing, that monitors our compliance on your platform. So now there is a mutual understanding that we have a skin in this game together. So we had to follow all of our requirement, and we got ourselves completely aligned there. And all of that started our journey towards a high trust certification. I mean, I'm proud to say that us as an organization, as a differentiator today in the market, we are the only ones who are a high trust certified organization. And we got out of that, we got our certification with zero cap, which is amazing. And we were able to achieve that in a few years. But the good thing was we were able to use Microsoft compliance as a way to get ourselves aligned. And then we've created our own system development lifecycle program, basically defined different processes for creating applications on the Office 365 platform, to how do you define content, what kind of PII is allowed to, and when you put it, where do you put it? We've come up with a whole policies around that. And because we've defined some of these processes, as a request comes in, and that's part of Sarah's team's role, is basically they ask about 5 questions. And if any of that has a PII or a PHI request in it, they know exactly, send that information to our security team, and information security goes through several checks and balances, and at the end of the day, everybody has to align to our guardrails that's defined in there, who has access to it, multi-factor authentication, et cetera, et cetera. I mean, so we've done several different things in there. We have over 75 routines to review access on the application itself. And then we've built a lot of standardization around how we basically, through policies and procedures, as to how you provide access, who gets access, what can go in there, what cannot go in there, what kind of secret portals do we create for PHI, PII, et cetera. So, I mean, we could probably spend several hours just on that.
We could do a whole show on this.
Exactly.
Yeah.
So if you want to go even further detail, but this is at a high level. That's what we've done.
I think this is great. Now, COVID really moved up the need for health in place. So kind of what's next for telehealth? If you say, this is our big bet, what is that big bet for the next, 18 to 24 months?
Yeah, like I said, our organization is so, in the sense they are always thinking 10 steps ahead, and they're so innovative in that, in their own ways. They'll try to push this. As I said, they're pushing the boundary of medicine. Our next big thing is health in place, and the goal of health in place. That's something that our CEO, Dr. Mahmoud Thompson, coined. The goal there is we need to meet our patient wherever they are, and for whatever their needs are, and that we provide that. And that's through providing telehealth as a network, if you may, or through our outpatient medicine that we are thinking about, or through at-home healthcare, at home through remote patient monitoring, et cetera. So that's those are the different goals that we are looking at, and through our investments in these early stage startups to even other big vendors out there who are planning to get into those markets.
I want to thank you for your time today. Before we close everything up, I do want to mention the Vituity Cares Foundation, which is about meeting people where they're at with their healthcare needs. They're doing pop-up clinics. We talked about it a little bit in the opening. You can go to vituitycares.org to learn more about that. This has been great. I encourage all of you to keep an eye out for our blog from Moveworks that we'll have up on Tech Community that will dig more deeply into their solution and how they help to get Vituity to this point. And it's been great. And I'm very excited to see what's next for you, Amit and Sarah and Varun, how you're going to continue to help companies like this to create that frictionless environment that they need to be successful. So thank you so much for joining. I want to thank all of our speakers. So that's it for this episode, our first episode of season 5. I want to thank all my guests again. We have some very, very exciting guests coming up for the rest of the season. So keep an eye out, watch for our blogs, check us out on social, and join us for our next episode of Inside Microsoft Teams. I'm your host, Stephen Rose. Thank you for joining. We'll see you soon. Bye-bye. And that's that. That's how we do it.